students. We will be shortly going live. Okay, we're live on YouTube. Thank you to Dr. Emmanuel D. Williams and Kelly D. Holder. Both of them gave really interesting thoughts on this topic. Now we'll move on to our course directors, Dr. Omar and Dr. Faisal Aziz. I will introduce you guys once again for our next audience members. So for those of you who have just joined us, Dr. Faisal Aziz is an associate professor of surgery, program director, vascular surgery, residency chief, division of vascular surgery at the Penn State University. We also have our course director, Dr. Umar Farooq, with us, who is an associate professor of medicine and associate chief medical officer at the Penn State University College of Medicine. Thank you both for joining us today. My name is Aisha Rehan. I'm the president of VFOD Pakistan, and I will be facilitating this session along with Nesam Ali, who is the vice president of VFOD Sindh, Interior Sindh. All right, thank you guys for joining us today. This interactive session is going to be an opportunity for you guys to discuss everything related to burnout. Any questions that you have, our course directors will answer those questions. First of all, I would like to request all of you to please turn on your cameras so it's more interactive and we can actually see you guys and you guys can see us, so that it's a very two-way conversation. And I would also request you guys, if you have any questions, please raise your hand. There's a feature on Zoom where you can raise your hand and I will call on you and then you can ask your question. All these things said, let's move on to the discussion. Dr. Omar, over to you.
Thank you, Dr. Aisha Rehan, for the kind introduction. So why the question I kept asking myself before we selected this topic, I think with the pandemic, the burnout also has risen to the top. And this is not just limited to the medical students. The burnout is there for healthcare professionals at many, many levels. So this is really something which is for all of us in this Zoom room and beyond. We all need to kind of pause, look into ourselves and see where do we stand, how things are going. So really this discussion is for all of us in the room. So I agree that we need to have more participation. It would be helpful if people share any of their stories, tell us how they feel about it, because trust me, how you feel is very, very important. We all need to be very kind to ourselves, and we need to remember that don't forget about yourself while you are serving or helping others. So I will ask Dr. Aziz to say a few words, and then really we need our participants to ask us questions.
Should we wait for questions? I think it'd be so. I think as we're getting used to Zoom conferences, it is very awkward in the beginning of every session like this to ask questions, because people are thinking, people may be shy, and it's difficult to ask questions in the beginning. So I think we can start some conversation, but I will encourage everybody to ask questions as they arise. So burnout is, so I'll share a few thoughts since we have no question. So burnout term is real, is new. You know, we did not have the term, I did not hear this term burnout till a few years ago. But the phenomena of burnout is very well known to us. And, you know, for this particular group of people which are mostly medical students, we all know. So when I joined a medical college in 1996, and I remember looking back, many people around me who were exhausted emotionally and mentally during the medical college, and I'm sure you guys can relate it too. So I'll give you an example of one of my seniors from I did my FSC from Carrick College, Hasnandal. So there was a guy who was senior to me a few years ahead of me. When I joined King Edward Medical College, he was our senior, but he tried to commit suicide. after his second year, because he was the topper of our classes throughout his life. And during medical college, he failed in the professional exam for physiology. So that was such a big trauma to him that he tried to commit suicide. And after that, he survived. And then he took the exam the next year and he passed the exam, but he was scarred for the rest of his life. His thought process changed. And I knew him for many years before. He just became a very different person. So I looking back, and I think we look at many examples of burnout, but that example stands in my mind to date, 25, 30 years later. That what did our system, what did our medical education system, which was designed to educate a young, talented human being, did this to him, that his life changed forever. um, and I'm sure all of us in this room can relate examples similar to that. That how many people had a scarred up life. So the term burnout is real, but the phenomena that we all have seen all our lives. The thing which is different now is that more and more people are recognizing it. More and more people are knowing about it. More and more people are talking about it. So your generation, the younger generation now, actually knows that it is normal to feel this way. There are people who have suffered from this before, and it's not in our times, when somebody would behave like this, everybody would say, well, this person is weak. It turns out, no, that person is not weak. That person is just being human. And our systems are not allowing that human being to progress in his or her life. So I'm really glad you guys listened to this conversation, to know if any of you is suffering from this, or have similar feelings. It's perfectly normal, and there are ways to fix it.
So thank you, Faisal, for a great starting statement, as well as sharing your personal experience and story. I just kept thinking that, you just all of us pause and think about it. How do you, so the process to enter in the med school, it's very difficult. Okay. So then you take the cream of the nation, and then once the medical school starts, it's made tougher and tougher for you to progress from level 1 to 2 and 3 and 4 and onwards. Yes, it's important to set the bar high, but how we manage that, while Faisal was sharing his story of physiology, I was it reminded me of our physiology and anatomy days. So first couple of years, the learning curve is very high, very steep. Plus, you are subjected to a lot of stress and this peer pressure. I still remember that 50%. So any test, you have to take 50% to pass the test, and the person with the maximum score is 27. And you know what? Half of the class failed the test. So the performance, if you look objectively, so this was before the MCQs were very active in the place. So this was more like essay writing. So if you compare the test like very objectively, I don't think the person who scored 24 and failed was any different than the person who scored 25 and passed, and sometimes 26 or 27 and aced the exam. But this post-traumatic stress disorder we still have was very powerful. We had to work hard. We had to really remember the books from A to Z, sometimes without understanding what we are remembering, right? So that is a depersonalization. Like you are doing something just for sake of doing, without understanding. Is this helping you? all the sheer stress. You are always under the stress. And this has led to even our own individual growth and development into a certain ways that we still have remembrance, or we still remember those times, that why, and question why we were subjected to this much stress. And many of the students, they were all cream of the nation, best of the best. They depersonalize, they change their personalities. It's just like, again, Faisal said very rightfully, we did not have this term invented back in the time, but phenomena was real. And just all of you think about it. Maybe it's okay for any of you to share your personal story as how you see the burnout and how this has impacted you in the past, maybe something you did to overcome, and how successful you are. And I think this is the time when we all need to share the story. We all need to talk about. Maybe Aisha, you want to say something?
No,
Do you have
I
any
yes,
personal story to
I
share?
want to call in someone from their participants. If you guys are comfortable, Arfa, can you please unmute your mic and tell us what is your perspective on this? I can see a few familiar names. Kainat, Fatima.
Assalamualaikum everyone. Can you hear me?
Yes, we can. Thank
Okay.
you for participating, Kainat.
Thank you too. You were asking like a story of burnout, and the thing that just came to my mind that we had our professional examination of third year MBBS, right, in February. So in first year and second year, we were used to like give exams. There used to be 3 exams. Okay, so written will almost be over in 11 to 12 days, right? And in third year, there used to be 4 like major subjects, and the BS was the fourth one. So obviously we had to study for that. And when we were done with the pathology, we could not make a study for like BS. We just tried so much, but we couldn't study. We were like, you say, euphoria. You are stressed, but you're laughing out loud, and then like laughing and tears in your eyes, and like it is such a state. I can't tell anyone what was that, and my friends just know that very well. And then we like we just opened a book, and then we wrote the topic burnout. We like read the topic burnout in the BS. So we were like, yes, this is the situation, this is what we are facing. And
So
like,
for
so we
anyone who's wondering, that to give a little perspective, it's behavioral sciences का एक subject होता है medicine में that भी हमें third year में देना होता है exam. So in that subject there's a separate part on burnout, ironically speaking, कि burnout जो ना उसके ऊपर. Okay, so Kainat, you can continue.
no, it was just like I am almost done. Okay, then I could like name my situation, what I was feeling at the time. So I was like, yes, this is the term, this is the thing I am feeling right now. And my what I'm feeling and what are my emotion that I am, and the thing that I can't study more is not the thing that is like lacking in me. It is actually the thing that is justifiable, and many other students may also be feeling that, and that is just not on my part. This is actually a thing, and that needs to be uh, like, I don't know what is the solution for this. And I talked to seniors, and they said, okay, you can give 4 profs in this year, and even you have to give like 8 exams in final year. How will you cope up with that? And I was so horrified at that time, like 8 papers. I don't know how we will do that. So I want the speakers also to like say something on that. Okay, 8 exams consecutively, and like if we can't give 4, so how will we like attempt the 8 of them? So like I'm just done. Thank you.
All right, thank you so much, Kainat. आपने अपना input दिया. अब I'll give it over to Dr. Faisal Aziz to speak his mind on this.
So Kainat, first of all, thank you for bringing it up. If it makes you feel any better, many people who have gone through medical school before you have suffered from this very similar feeling. As you described euphoria, that was personally my medical school as well, that you laugh at the insanity of situation, that this cannot go more crazy. So it has happened to all of us. So I think the deeper issue, I can tell you, I'm older than you and gone through this many years, after gone through it for many years. So I think the deeper issue here is why, and what can we do, we as in all of us, to prevent it from happening. So that's the fun part of getting old, that you've learned from your mistakes, you've learned from what have happened to you, and you want to do something good to the future generations, right? So that's a part of humanity which makes us good human beings. So it is crazy, right? It is insane in my mind that it happened to my generation, it happened to generation before me, and it's still happening 25 years later to other generations. So why can't we fix it? So first of all, what can we do to fix it? Number one is exactly what we're doing right now. So I hope that people listen to us, right? That we as a medical community are openly and frankly talking about it. I can tell you what's different, Kainat, is that 25 years ago, when Dr. Farouk and myself were in your shoes, we could not even talk about it that time. At least you can vent out your feelings at sometimes. So that has changed. That makes me feel very happy. We did not have the luxury to do that because then we were afraid we were going to fail the next professional examination. So first thing is to talk about it. So that's one thing which is good. I think the bigger issue is that our education system has to change pretty big time. 25 years ago, when we were in medical school, there were no multiple choice questions. Everything was subjective essay type. At least you have some multiple choice questions. As Umar said, there's not much difference between the score of 24 and 25. 25 is blue, pass; 24 is red, fail. Such a gross injustice. My worst story was when you pass with 24 plus one grace marks. It has happened to me many times as well. So I think the system has to change. Our education system has to realize we cannot overburden very smart medical students who have come after giving so many examinations. We just cannot put this much talent, this much high IQ in a box, in a pressure cooker, and turn the heat on and let them fry their brains. This is not normal. We should stop doing that. If medical knowledge is difficult, what at least we can do is to make the examination system fair. I'm not asking to make the examination system easy. No, it's not supposed to be easy. We're supposed to be better doctors. We're supposed to be good physicians. Just make it fair. So that's one thing we can do as a system. Now, what can medical students do? And all of us, you guys know more than me. I'm just a dumb surgeon. So I don't know about psychology, but I remember that curve, the stress and performance. You remember the bell curve that we have, that, when you have stress, your performance goes up. But it hits a point where after that, more stress, that performance goes down. The interesting part is, for all of us, that curve is different. For all of us, that top mark, the apex of that curve is very different. Some of us can take a lot of stress. Some of us cannot take that stress. So I think all of us, what we can do at your level is to find out, not let me rephrase, is to know your curve. You don't want to be in a position as my senior did, to try to kill yourself. That is bad. You should stress is good, and performance, as long as it enhances your performance. When you reach a certain stage that you feel like you hate life, all the signs that you saw in that presentation, that you hate life, you hate yourself, any of that happens, that's the time to call for help. Ask for help. Ask your friends. Ask your parents. Get to your inner selves. Whatever makes you feel at comfort, go to that place. Omar?
I think you summarized very well. When I so nephrology service, so I cover nephrology, and when we have the inpatient service, it's very busy for us. So in my hospital, and it's actually nationwide trend as well. So I may be seeing 30, 40 patients, maybe some of my colleagues see 60 patients. It's a lot of patients to see in a day, which is sometimes it feels humanly impossible. Then you have the medical student on your team looking at the list. You know what? The number one thing I tell them, that guys, listen, less stress, no stress. Do not take stress off the heavy service. Day one, day two, nothing is going to make sense to you because of the learning curve. Things will start to sink in on day three, day four. What you need to do is you need to be present, you need to have some fun, and you need to, you are here to learn. You do not need to get killed to learn. And these are the exact statements, exact words I use every time I start the service on day one for a new medical student, that you do not need to get killed to learn. You know why I do that? Because of all my life experiences, as where you are now in your stage, that you have some experiences recently, when the system thinks that students need to really get killed before they can learn everything or anything. So no, so the learning theory is different. You can still learn, there are different other methodology to learn. So we don't need to put you in the pressure cooker as a system. And this is where you as the learners need to be kind to yourself. I think by just having awareness about it, that this is a real thing, by just accepting, that's the first step. So how many of you feel that you are at that step in your life? Just ask yourself question. You can say yes, no in the chat. You can say thumbs up, thumbs down. Do you guys feel that you are at a stage where you can ask this question to yourself or not? Or have you ever even pondered inside that, are you burning out? What kind of answers you get? You know, somebody said thumbs up, which means like you are able to think. That's good. Because I do want, more yeses in the chat. We have 27 participants in this live Zoom. So we are, I see people are now. So maybe if anybody wants to share your story, your personal perspective, I think that's where the value is. We want to hear you. And then you want others, your peers, to hear yourself as well. And that can help them. So that's the kind of service you're doing by just sharing your story. So I encourage somebody else. Maybe Mason, you want to say something?
Yes.
Otherwise,
So,
go ahead, Mason.
okay. So my personal experience with burnout, I would say, was with our current rotation. We had to work around 16, 17, 18 hours every single day. And this is how it was for the past 3, 4 months. And as a result of that, I was neglecting a lot of things. I was neglecting my personal relationships, my hobbies, my interests. And eventually I just stopped caring anymore. I didn't want to go to the clinic. I didn't want to invest further in my studies. So I took a break. I stepped back. I gave myself a week, and then I jumped right back into things. So.
Good job. I think this is probably a common theme, that overwork. Actually, you know, sometimes it's not the like we are all tuned to work hard. This is something common with a lot of physicians and students. There are some other factors so there was the constant work, like hard work, constant burden of too much work, and I think that led to maybe the feeling that this is not right. And I think it led to some of the things you stopped doing which you enjoy, or doing some things which you did not enjoy, and that led to, you know, some sort of a change in your brain, and you saw the results. So really, I think the important message which I want everybody to understand is being self-aware is very important. Anybody else? Or Faisal, you
Dr.
want to say
Omar,
something?
do you think we could take a poll over here? So
Sure.
the audience
Yeah, I think
members
that's a
could
good time. So
answer
I
the
think people will
questions.
say
All
through
right.
polling.
All right, everyone. अभी हम एक poll करने लगे. You will see the poll on the screen, and I would encourage everyone कि आप लोगों ने जो भी option आपको लगता है that is the closest to your heart, या आपको जो ठीक लगती है, आप उस पे click करें. Mariam, our IT moderator, she will share the poll with you guys. Can you guys see the poll on the screen?
This is the old one. Maybe I think we have to, actually, let me go to poll 2. So now, is it poll 2 visible to you?
Yes, it is. All right,
Okay, good.
everyone. This is the first poll, actually. Wait, I'll show the second poll. All right.
All right.
Can you guys see the poll?
Yes, we can.
All right, Mason, over to you.
I can see it. I can see it.
All right. Can you see it now?
No. And
All right.
all right. Perfect. Perfect.
Okay.
So the first question is there a correlation between burnout, depression, and stress? The answers are correlated and the same thing, correlated but are different from each other, and there is no correlation at all. This was actually very well explained in the video. There was a different thing.
So Aisha, I'm trying to cast my vote, but I'm unable to click on any. Now it's now you can. I think people are doing it.
The second is, in your opinion, which of the following is the most important cause of burnout? The first is excessive workload. The second is loss of autonomy, flexibility, or control. The third is loss of meaning in work, inefficient work environment, problems in work-life balance. And the third question is burnout preventable, treatable, and curable?
So we have 60% of the votes. So maybe you want to give 20, 30 more seconds and then we can start talking about it.
Yeah, definitely, sir.
All right, everyone, the poll will end in 15 seconds. Please cast your vote now. All right,
Okay.
so I'm going to end the poll and we're going to share the results.
So Mason, are you taking the look at it and share the results with us?
Yes, sir. So the first question is there a correlation between burnout, depression, and stress? The most popular answer by far was correlated but are different from each other. In your opinion, which of the following, the second question was, in your opinion, which of the following is the most important cause of burnout? And this was fairly balanced between excessive workload and problems in work-life balance. Others included inefficient work environment, loss meaning work, they're the same as well. And the third, of course, 100% of people said that yes, burnout is preventable, treatable, and curable. So which question would you like to discuss first?
It's up to you.
I personally find the first question most interesting, really interesting. What if there is a correlation between burnout, depression, stress? What is it?
So who wants to take Mason? What do you think about your opinion of what kind of vote? So there we have 13% or 2 people said that this is same and there is correlation, and vast majority 88% said that it's connected, correlated, but this is slightly different. So what's the difference? Burnout, depression, and stress. So Mason, why don't you share your opinion as how you see it?
I think burnout can exacerbate depression, but as the video stated, they are outputs of different different factors.
Mhm. So let's talk about stress. So stress could be a positive stress and the otherwise, like not so positive stress. I mean, how many, I remember, I know I'm a last minuter, so the stress of exam tomorrow or stress of any event, the deadline was probably one of the stress, like you have to, this is the finish line, the last 6 hours, the night before is stressful, but it increases my productivity. But again, I think that just Dr. Aziz mentioned about this learning curve or the bell curve, that beyond a certain time or a certain point, it's not as positive stress anymore. And we all know that there are negative stresses in the life that lead to decrease in your productivity, decrease in you being yourself, and then this just leads to the burnout or decline. So I find some correlation between this stress and burnout. But I also feel that if even the positive stress, if this is there prolonged without any breaks, this may also have detrimental effects as well. But stress is helpful, but at the same time, you need to be mindful as when to stop, when to take a break, when to back off. What do you want to say, Faisal?
I agree with all. I mean, I think it's a very sensitive and very important topic. So I think I agree with what you said. I think at a medical student level, burnout is very common, and in Pakistan, it's even more common because of the hierarchical or system that we have. I mean, medical students don't have much say in shaping up their. It's a unilateral power situation. It's very common. But I think my only advice to medical students is that whenever you feel that you're getting burnt out or you're exhausted like this, always tell yourself you're not the first person in through the med school. There are many generations before you have gone through and have turned out okay. So it is perfectly normal to have these feelings. Second, you are important for yourself and for your family. There's nothing worth hurting yourself at all. You can always, even if in student life, you always feel like, oh my God, if this exam failed, I don't know what will happen. It's the end of life for me. As it turns out, when you grow up, nothing can kill you except death. So we're all going to die one day. But anything short of that, all of us will face many stresses in our lives. So, but nothing is worth, hurting yourself. So just if you feel at any point in time that you're going to hurt yourself or thinking about it, back off. It's okay. Exams come later. Many things in life can be repeated again and again. It's okay.
Thank you, Dr. Omer and Dr. Faisal. Doctor, it's almost time to end this session. If you guys would like to give some concluding remarks regarding the physicians as healthcare leaders talk and the burnout in medical students talk as a quick summary of what we talked about today, and then we will see the participants in tomorrow day 2 session on June 26th. So over to you, Dr. Omer, if you have any concluding remarks.
I think going back to the physician leaders in the healthcare, the servant kind of leadership is the type or kind of leadership we need to develop and promote. So there are different types of leaderships and different styles of leadership. So there is one called servant leader. And there is a very well-defined way how you incorporate that and value your people. So please value your people. Take care of your team. And that makes you a better leader as when you compare to others. So touch to your base. The second thing on the burnout, again, I see this burnout is real. You can prevent it. Just be kind to yourself. Over to you, Faisal.
Yeah, you summarized so well, Omar. I can't add more. Only thing I would say is that you all are leaders. All of us are leaders in some aspect of our lives. Our jobs as human beings and as physicians is to become better leaders, to become bigger leaders, and every day we can do something to make it happen. And regarding burnout, all I can say, as I said before, your life is precious. I truly believe all of us are alive in our place at that place of whatever we're doing because of a reason. The powers to be realize that we're not needed. That's the day we die. So as long as we're alive, we have a purpose. We have a mission. All of us should recognize that and don't get burned out at all. Tell yourself it's okay. I'm a human being. I will get frustrated. It's normal. Thank you once again.
On that note, thank you very much, Dr. Ben, Dr. Faisal, and thank you to all the participants and all the viewers who are watching us live on YouTube. We will see you tomorrow for a session on self-management skills and our second talk by these course directors on under the topic called Agree to Disagree, the Pathway Forward. We'll hope to see you guys tomorrow as well. And thank you once again for joining us today. Thank you and goodbye.
Bye.
Thank